Good afternoon. I'm really pleased to be here and applaud you for all of your hard work and success over the years and for continued participation today. Before I begin, I just want to ask you to do two thought exercises. Just close your eyes and think of home, whatever that means to you when you were a child or what it means now. Just think of home. Now I want you to think of, remember the last time, spend a few seconds thinking about the last time that you were sick, whatever sickness that was for you. Okay, when you thought of home, what is one word that that was evoked from those memories? Just shout it out.
Safe.
Safe.
Comfort.
Space, comfort,
Family.
happy family. Okay, we keep going on. Oh, these are overwhelmingly positive for most of us. And when you thought of illness, now just think of being ill without a home. Think of your experience of when you were ill, what you needed. You needed safety, you needed comfort, you needed a place to rest, and just imagine what it was like for you. It would have been like for you if you weren't able to recover at home. So we have approximately, no one really knows the number, the best hard number. It comes from a point in time count, which is a little over 500,000 of our homeless neighbors, and our neighbors in this country are experiencing homelessness. That's just one night in time. So over a period of a year, we know it's much more than that. We also know that homelessness is hazardous to one's health. For every medical condition, it is found in the population of people experiencing homelessness, but at elevated rates. And for every condition, it is harder to treat when someone does not have a home than compared to when they do have a home. So I just want to introduce the National Healthcare for the Homeless Council for a minute. Many of you may know of the federally qualified health centers, the health center movement. There are about 1,400 health centers across the country. There are about 300 programs in that larger health center movement that focus on providing healthcare to homeless people. And what the council does, it supports those 300 healthcare for the homeless programs, also about 80 medical respite programs around the country through training, technical assistance. We have about 225 organizational members. We have 4,000 individual members, about 2,000 clinicians on the front line, doctors, nurses, social workers on the front lines in these clinics and in these medical respite programs. We have about 1,000 members who are part of our respite care providers network. And most importantly, we have about 1,000 members from our National Consumer Advisory Board, which are people who have experienced homelessness in the past or are currently experiencing homelessness and getting their care from our programs. They really drive what we do, and what we are trying to do is make sure that every healthcare for the homeless program has consumer advisory boards, have people with the lived experience on their governing boards, because we know that makes the difference. So I was asked to speak for a few minutes about sexual violence and also the opioid. So I thought it fitting to share with you a study that was led by our National Consumer Advisory Board, which was then published in a peer-reviewed journal, on their experience in surveying people experiencing homelessness. So this was designed by our Consumer Advisory Board. The IRB was with the Nashville Department of Public Health, and also had some advisors from Vanderbilt, but the leaders were members of our National Consumer Advisory Board. So the study surveyed a little over 500 people through structured interviews in 5 cities. And what they found was that violence is endemic in this population. The study found that 62% of those interviewed had witnessed a violent attack. 32% of those that witnessed attack had witnessed it in the last 30 days, so this is an immediate problem, and 81% of them had witnessed it in the last year. More important, experiencing being a victim of violence. 49%, well, about half of those that they had been a victim of personal violence. 30 of those, 30% in the last month, and 73% in the last year. Interestingly, for just the general violence for men and women, it was about the same. Where the violence took place, most of it took places in public spaces. 58% took place in streets or alleys, 16% in a park. 31% of them said that they knew their attacker. One of the places where it differed was in sexual assault. 15% of those surveyed, of the women surveyed, of everyone surveyed, said that they were the victim of sexual assault. And unlike in the general population, among women, where in women most know their attacker, for those women experiencing homelessness, most did not know their attacker. It was by a stranger. And when we think about what home is for us, it is a place where we can lock the door. It is a place where we can find safety. It is a place where we can only let in those we choose to let in. But if you are living out in a park or on the streets, you don't have that luxury, and so you're much more likely to be victimized by a stranger. I've spent most of my life and career in New York City. I'm here in Nashville for the last 2 years. And in New York, I would, on my own time, do street outreach. Unlike in New York is not like most of the country where there's a right to shelter. So most people experiencing homelessness are in the shelter, and relatively few, percentage-wise, are on the streets. As I do outreach here on my own time in Nashville, for the first time I've been going to encampments where up in the woods or just off the beaten track, but not by a lot, tent cities, and I'm struck by how many women are afraid for their safety. There's one encampment that the group I'm volunteer with, they have a women's camp that they know about where it's just women, and they will try to get women there. They've gotten some of them into apartments, but they say, please, can you get me out of this encampment? Because they know that they are victims, they're prone to being victimized, they have been victimized. So this is an endemic problem for those experiencing homelessness. I was going to share some information from a webinar that our agency did in March on this topic, where our partners were the Downtown Women's Clinic, but since they are here, I'll let them present their data. But to say it's extremely rich, and it just adds to that experience in a really sharp way. I'll just turn for my last couple minutes to the issue of the opioid disorder among people experiencing homelessness. As we know, it's a crisis in our country. It is higher, the rates of substance use disorder and opioid use disorder is higher among people experiencing homelessness. And substance use disorder among people experiencing homelessness is rarely found alone. It's almost always found, or it's often found to be comorbid with mental illness, with other physical chronic conditions. In a 2013 study by the Boston Healthcare for the Homeless program, they found that, and this was prior to the awareness and the upsurge of the opioid crisis, 17% of the deaths among those who died on the streets in their program were due to overdoses, and 81% of those deaths were due to opioids. They found that people experiencing homelessness among the age of 25 to 44 were 9 times more likely to die from an opioid overdose than their counterparts who were housed. There are some recommendations that we have. First, for those dealing with sexual violence, it is that, and these come from our consumers along with clinicians working alongside them, that in healthcare settings there needs to be more routine screening for violence. We have a number of screening tools, but this has to be part of the practice, especially if you're working with a population where this is endemic. There also needs to be trauma-informed care and there needs to be comprehensive wraparound services when working with this population, especially women who are more likely to be victims. We have recommendations also for dealing with the opioid epidemic. And I'm pleased to say that healthcare for the homeless programs have been leading in this from the very beginning. From the very beginning, we've had to deal with whole person care, had to deal with social determinants of health, and had to deal with integration of behavioral health and primary care. To the point that of the 1,400 healthcare for the homeless, health center programs, healthcare for the homeless programs serve 4% of all the patients, but provide 40% of max services. So this is what we do, and this is the experience that I'm bringing to you from there. Their recommendation is that there needs to be more training of medical providers in medication-assisted treatment, especially naloxone, which needs more funding to be more widely available. But also, there needs to be more of training and investment in harm reduction. Abstinence works for many people, but it does not work for everyone, and perhaps it doesn't work for everyone, for most people right away. So finding ways to reduce harm, to meet people where they are, and then bring them to a place where you can preserve their lives and help them reach their dreams and their goals. So thank you for your time. I'm privileged to bring the wisdom, the knowledge of our consumers and our clinicians to you. Thank you.